This Focus on Health segment is brought to you by Aurora Health Care.
Hello and welcome to another edition of Focus on Health. I'm Dean Leisgang. Today we're at the Aurora Health Center on Doctors Court in Oshkosh talking about breast cancer screening. Family doctor Patricia Morales took some time to sit down with us and highlight the new guidelines. Patricia, thank you so much for making time for us today. Obviously a very important topic when we talk about breast cancer. New guidelines released. Tell me what the biggest changes are that you see in your eyes that our viewers would like to know about.
First of all, thank you so much for the invitation. I'm glad to be here and to communicate this message to the general population. Basically, one of the major changes is the recommendation about self-examination, okay? Here in Aurora, we're following the American Cancer Society guidelines, who actually go against recommending the patients to do self-exam, and that comes because a lot of times they find lesions that most of the time are benign. There's also controversy about physician-performed exam, but that will be case by case.
So what are the circumstances that are recommended for screening when you maybe look at risk factors and other elements?
Okay. Nowadays, we are offering start screening at 40 years old, okay? But again, following the guidelines for the American Cancer Society, the ladies are strongly advised to start mammograms at age 45 on a yearly basis until they are 54 years old. At that age is when they have the highest risk of being diagnosed and potentially cured from the condition. After 55 years old, it's every 2 years until the life expectancy is around 10 years.
So Patricia, what is the preferred screening method based on these new guidelines?
Mammogram is the first and gold standard for screening. There's other modalities like tomography, ultrasound, and MRI. Usually we start with the mammogram, and depending on what we obtain, the results of the test, then the follow-up testing would be an ultrasound and MRI testing.
So just kind of reiterate, you want the patient to know their body, but not the self-exam at this point.
Correct. I mean, most patients come and say, I'm checking myself in the shower. That is fine, but it's not like you have to go every month, especially around the period and stuff like that, like they used to recommend. The issue is that, for example, I'm feeling something weird when I'm, showering. My nipples are changing. I'm noticing that there's some kind of change in the color of my skin or some redness. Those are worrisome signs. Another thing that the patients do not know is that usually when there's some problems in the breast, you may have some lymph nodes in the clavicle area, and those are very subtle symptoms that most people don't pick up right away.
Anything else you want to add that really stands out in that report with the new guidelines that have come out?
I think it's important for the patient to know their family history, because that would determine exactly what risk category they are. First degree relatives is extremely important, a mother, a sister with breast cancer, and the age that they were diagnosed. Another condition that are related to that is history of ovarian cancer or previous cancer in general, okay? Any kind of cancer in the genital area, the reproductive area, will place the patient in a higher risk. Patients that are Ashkenazi Jews descendant, okay, or that have received some kind of radio chemotherapy for other type of cancer in the past.
Very good. Great information to pass out to our viewers. Thank you so much for joining us today.
Thank you so much for the interview. I hope it's useful.
For more information on these new breast cancer screening guidelines, feel free to contact Dr. Morales at 303-8700, or as always, you can contact your primary care provider. I'm Dean Leisgang. Thank you so much for joining us. We'll see you next time on Focus on Health.
This Focus on Health segment has been brought to you by Aurora Health Care.